Okay, so in this tutorial I'm going to talk to you a little bit about the blood supply inside the kidney, because this can be a little bit confusing sometimes. So we're looking here at the abdominal aorta, the inferior vena cava and the right and left kidneys, and you can see the renal veins and arteries coming off these major vessels and entering the kidney at the hilum together with the ureter. So you can see the ureter here. So we're going to take a look inside the kidney and see what's going on with the blood supply. So we're looking at a slice of the left kidney here, and you can see the renal artery, the renal vein, and you can see the ureter and the renal pelvis at the hilum. So as the renal artery approaches the hilum, it splits into two branches. So you've got an anterior branch and a posterior branch. So these branches then split further into segmental arteries. These segmental arteries then pass up along the renal columns. So you can see how the segmental artery passes around the side of the medullary pyramid, and these arteries running up the sides are called the interlobar arteries. So they're called interlobar because inter means between and lobar refers to the renal lobes. So a renal lobe consists of the renal medulla combined with the cortex that sits above it. So I've just drawn a renal lobe on in green. So I've just drawn a couple more on there, and they're called interlobar arteries because the arteries run alongside the medullary pyramids between the renal lobes. So the interlobar arteries come off the segmental arteries. So at the base of the medullary pyramid, the artery curves round, and it's called the arcuate artery. So it kind of arcs around the base of the medullary pyramid. And then coming off at 90 degrees to the arcuate artery, you've got these little extensions that radiate into the cortex. So these arteries are called the interlobular arteries. So it can get a bit confusing because interlobar and interlobular are very similar, but if you just remember that interlobar are called that because they lie between the renal lobes, so on the sides of the medullary pyramids, then it will help you to remember the difference between interlobular and interlobar. So the renal lobes are actually divided into little lobules, and you've obviously got the corresponding interlobular veins. So now we're just going to zoom into one of these renal lobes and take a look at what happens with the blood there. So we've just zoomed into a renal lobe, and I'll just orientate you a bit. So you can see our arcuate arteries in red arcing round the boundary, the border of the medullary pyramid, and you've got the corresponding arcuate vein. And coming off the arcuate artery and vein, you've got the interlobular artery and vein, so the interlobular vessels. So beneath these arteries and veins you've got the medulla, and outside is the cortex. So the interlobular artery gives off branches called the afferent arteriole, which forms the glomerulus, which is this network of capillaries contained within the glomerular capsule. So this capsule is called it's called the Bowman's capsule or glomerular capsule. So these two structures combined, the glomerulus and the glomerular capsule or Bowman's capsule, form the renal corpuscle. So after the glomerulus, the pathway of the blood is different depending on what nephron we're looking at. So in the kidney you've got two types of nephron. You've got cortical nephrons and juxtamedullary nephrons, and they're sort of determined depending on the location of their renal corpuscle and their loops of Henle. So the juxtamedullary nephrons have their renal corpuscle right next to the medulla, so that gives them their name, juxta meaning next to, and medullary referring to the medullary pyramids. So just imagine that this renal corpuscle here lies much closer to the medulla. So that's the juxtamedullary nephron, and their loops of Henle extend right into the substance of the medulla. So the loop of Henle is quite deep. So let's just say this is the cortical nephron. So a cortical nephron has the renal corpuscle further away from the medulla, deeper into the cortex. So this is I've just drawn onto this diagram in paint. I've kind of massacred Gray's beautiful artwork, but this yellow thing is the proximal convoluted tubule. So the loop of Henle of a cortical nephron is much shorter. It doesn't penetrate as far into the medulla. So cortical nephron, renal corpuscle is further away from the medulla, and the loop of Henle is much shorter. A juxtamedullary nephron has its renal corpuscle right next to the medulla, so juxtamedullary, and its loop of Henle it penetrates much further into the renal medulla. So why did I bother explaining all that to you? Well, going back to the blood supply, so we've just come off the interlobular artery, forming the afferent arteriole, which goes into the glomerulus, and then the glomerulus, out of the glomerulus comes the efferent arteriole. So in a juxtamedullary nephron, the efferent arteriole forms the vasa recta. So again, this is more Latin, and it just means straight vessels. So these vessels follow the loop of Henle downwards, straight downwards, hence the name, and it has this sort of hairpin turn, and it follows it again up, straight up. And then the vasa recta drain back into the interlobular vein, and then the interlobular vein drains into the arcuate vein. The arcuate vein drains into the interlobar vein. Remember, that runs down the side of the medullary pyramid, and the interlobar vein drains into the renal vein. So what happens with the cortical nephron? Well, we've got this vessel coming off, so we've got the afferent arteriole coming off the interlobular artery. It goes into the glomerulus within the Bowman's capsule, and then out comes the efferent arteriole. And then the efferent arteriole forms these peritubular capillaries. So peri meaning around, capillary, tubular referring to the renal tubule. So you've got this sort of network of capillaries running over the renal tubule, and then this drains back into the interlobular vein, and then it follows the same course back into the arcuate vein, back into the interlobar veins, and then ultimately back into the renal vein. So that's the blood supply of the kidneys.